Welcome back, everyone, to this innovative episode of the Mental Health Entrepreneur Podcast. I'm your host, Rachel Harrison, and with me today I have Dr. James Cordova and Matt Rubin of Arammu, which promotes a checkup and maintenance-based model of mental health care. Welcome, gentlemen.
Thank
Thank
you.
you.
It's nice to
Great
be
to
here.
have you here.
Yeah.
So let's dig in. How did Arammu come to be?
So, it's like the long story or the short story. Uh, so,
Whichever one you feel like.
uh, when I was when I was an undergrad, I volunteered at a crisis center.
Mm,
And one of the jobs that I had at the crisis center was just to pay attention to and to track why people were calling in crisis. And month after month after month, the leading cause that people were calling in for were relationship issues.
hmm.
So that just really grabbed my attention in terms of, it seemed to me at the time as an undergrad, right? Like if you want to have a big impact on the quality of people's lives, it looks like relationships is the place to do that. And so I went from, that was at the University of New Mexico. I went to the UW, University of Washington in Seattle, to study with Neil Jacobson and John Gottman.
Mm,
And so learned about, relationships from John Gottman's perspectives and couples therapy from Neil Jacobson's perspective. And as I was sort of heading from grad school to my job at the University of Illinois, one of the things that sort of struck me as sort of everything was coming together is like the field of relationship health
mhm.
then and still now is sort of akin to the field of like physical health or dental health in the 1930s.
Mm,
It's like a century behind all of the other health fields because it's completely focused on reactive tertiary care, right?
right.
And we don't actually think about it as a health system. We think about it, I'm not even sure exactly how to articulate how we think about relationship health. We think about relationship satisfaction and whether or not you're happy or unhappy, right? So it's on this continuum of happy and unhappy. And what
Mm,
we know from decades of scientific research is that how you're doing in your primary relationship has a significant impact on all your other health systems, your
oh,
physical
yeah.
health, your mental health, but we're not treating it like a health system. We're not thinking about it as a health system. And therefore it's antiquated, right?
Mhm.
Like people don't think about seeking professional guidance, professional help, professional care on a regular, sustained basis in the same way that they do for their bodies, for their teeth, for their mental health, honestly, for their cars, right? Like this is the sort of thing that you
Interesting.
maintain. And that was a thing that was missing. If folks were suffering in their relationships, they went to couples therapy,
Mhm.
usually after years of suffering in their relationships, right? Which is
Yes.
really, in terms of like healthcare, on par of waiting until a tooth has been hurting you for years to go to the dentist, right? And then like, oh, what are you going to do? We're probably going to pull that thing, right? And so
Yes.
what felt like the innovation to me was regular care, right? So what really sort of made the difference in the other healthcare systems was preventative, regular healthcare maintenance. And
Mhm.
so what I really focused on was developing something that could be scientifically proven to be effective in that sort of repeatable way. And so initially I developed what at the time we were calling the marriage checkup,
Mhm.
and then since then have expanded to just the relationship checkup.
Mhm.
And the idea is it for it to be the annual equivalent of like your maintenance for your car, like a tune-up, or your regular dental checkup, or your regular primary care visit, right? So that you're getting regular health care
Mhm.
in a preventative and early intervention kind of way, rather than just like you're on your own. Your most intimate relationship is a total DIY project, and good luck with that. And when it starts, and maybe when it starts to break down, you might go seek care.
Oh,
Uh,
yeah. And
so
I
we
mean, I can attest to most couples coming in when it's pretty much at the very, very, very end. Yeah.
Right. Yeah. No, and that's what we know from the research literature, that couples, I mean, the bias for couples therapy at this point for all of us out in the community is it's a last ditch effort kind of
Yeah.
thing, right? It's a
Hmm.
relatively rare couple that thinks of it as something that you do before the last ditch effort.
Yeah.
So I developed this intervention called the Relationship Checkup, and have been studying it as an academic, right, for 20 years, 25 years. And we've done all sorts of randomized control trials and expansions, and have definitely shown that it works. And then my university, Clark University here in Worcester, was looking for things to get behind in terms of intellectual property. So they actually
Hmm.
approached me and asked, like, would you be interested in like spinning up a business from this? And
Okay.
and I had been for a while, but just sort of like as most academics, right? Like doing academic things. And so when they approached me, I thought, that's a really great idea. How do we even start? And
Hmm.
then that's when I met Matt.
Yeah, I'm sitting here thinking, how does Matt fit into this picture?
So I'll let Matt take that part from here.
Cool. Yeah, I actually went to Clark, so they're my alma mater. But
Ah.
my degree was in international development, social change. Went into entrepreneurship, my first job out of college, and so I bounced around a whole bunch of startups. I just sold one and was looking to figure out what was next, and that's when the mutual friend was like, "You've got to meet this professor at Clark." I'm like, "Oh, those two things sound
Mm.
great." And so I met Dr. Cordova and his research partner, Dr. Gray, and they told me this idea for this relationship checkup. I just gotten married. I was like, I think we're good. And he's like, no, no, that's the point. Like,
That is the point.
try it
Yeah.
now. And so we tried a checkup. It was definitely outside of my like comfort zone. I had
Mm.
my own sort of prejudices around mental health and just sort of like, oh, well, we don't need this. And so, but we tried it. My wife has her own mental health diagnoses, and this was enlightening, like transformational, just in terms of
Mm.
helping us better understand each other and how to work together and like understand how like her diagnoses impact her brain and like how her mind works and how I can play better into that. So we did it, and I was just bought in hook, line, and sinker. I'm like, the world needs this, like the couples
Mm.
need this. And that's sort of where we got started, was this, we know this is going to help couples. And over the years, we've really started to understand, especially as we've gotten to scale, the impact that this has on couples. Like, it has been great in private sort of industry as we've rolled out, but also there's impact on the providers, where like in just 1 hour, providers are able to make such a significant impact. I think the last research we did on it was that one checkup has the same clinical impact as 12 long-term therapy sessions. And so in just an hour, a provider is able to see a much greater impact that would normally take them months to see.
Mm.
And so it's like that immediate gratification that like sometimes is lacking in this space is something we had no idea was going to be a benefit. But as we've rolled this out, it has been great. And some of those issues with just sort of the demand for mental health services, not enough providers, like being able to do something this clinically impactful in
Yeah.
just 1 hour and get like two people in. And like, James was talking about, the relationship kind of underpins all these other mental health issues. And so by
Mm.
addressing that quickly and effectively, the sort of ripple effect throughout mental health is something we didn't, at least I didn't fully realize the full impact that this could have. And so being able to see this now at scale, and the impact it's having both on the providers, the like patients, the couples, but also like the industry as a whole, where you're actually able to start churning through some of your wait list because you have a tool that is super effective and doesn't take 12 or 24 sessions, just takes one. And
Mhm.
so it's been an awesome ride for the past, I think, 8 years that we've been incorporated now.
Amazing. Yeah. Yeah, so I imagine kind of like a primary care model with the
Hmm.
checkup. A lot of people come in and it's like, listen, you have these couple of things. Here's some tools you can use to work with that. We'll see in a year.
Hmm.
But what about the couples that come in and it's like, okay, wow, there's a lot more here and there might be more support needed?
Yeah, that's a great question. And, I designed the checkup, we designed the checkup to really be the relationship health equivalent of your primary care checkup, right? And so, as in any checkup, the idea is like, come as you are, right? And what we found in our research, thank goodness, is that we are able to attract couples across the spectrum of relationship health and satisfaction, from really healthy, like newlywed couples who just want to get started early on
Mm,
maintaining their relationship health and the quality of their intimacy and connection, to couples that just have a couple of issues that don't seem to go away and are really creating friction, but they're not like destroying their relationship. They're just sticky, right? And
mhm,
then they're also able to come in and get the help that they need so that those things don't become more and more corrosive. And we also get couples that are really struggling, that are
mhm,
severely distressed, that have been severely distressed for a long time. And like any checkup, right? What we're able to do is help folks that just need a little bit of help, right? Keep folks healthy that are already healthy. But if you're really struggling, we can sort of get you started on
mm,
reorienting towards the relationship, right? And starting to get some really good tips and tricks for how to begin to move forward, including being able to do referrals for longer term care,
okay,
right?
yeah,
So that's one of those things where sometimes couples are like, do we really need, I'm not sure, right? And what a clinician is able to do is help them make that discernment,
mhm,
like you guys are good, what we've got for you here is probably enough for you. Try this out, and if you're still struggling in 6 months, come back and see us again and we'll figure out what the next step is. Or you guys could probably use 4 or 5 sessions of like more intensive care, or 10 sessions of more intensive care, and these are the people that we would recommend that you see,
mm,
right? So we're able to sort of do that kind of warm handoff to more intensive care if couples need that,
sure.
right? But the broader goal is, if couples are getting regular care, they're less likely to find themselves in a place where they need longer term care.
Boy, I love that model. I think that's amazing. Do you ever find that it's difficult to get people? I mean, kind of like Matt was saying, like he had some barriers to coming in initially because they were like, I'm fine, I'm good.
Yeah, I think one of the things that we've benefited from is that the idea of a checkup is something that people just get, right?
Hmm.
And so checkup, tune up, regular maintenance, that kind of idea of like a stitch in time saves nine, right? Like people understand the concept, right?
Yeah.
And you get actually a significant number of partners in couples that will just resonate with that idea of like, oh, right, why didn't I thought of that before? Like regular checkups just make sense, right? And and um and of course, there's still some skepticism, right? Oftentimes, what we find when we've done our research is that um, you'll, particularly husbands, can be like, anything that even smacks a little bit of therapy, like, please, I don't want to do that, right? But something that sounds like a checkup, what they tell
Mm,
us is, well, I wouldn't have done therapy, but a checkup didn't sound bad, right? And then when they come in and they meet us, the experience that they have is, oh, that was actually good, right?
mm,
It was fun, it was interesting. I felt heard and cared about, and I felt like I left with like real things that I can do, right?
yeah.
Empowered in some way, right? Versus like I felt like I had my head shrunk. Right?
Yeah, no head shrinking
No head
necessary.
shrinking. That's right. Yeah, yeah, exactly.
There's definitely a lot more of like a viral or like peer-to-peer referral, sort of
Mm,
organic sharing that happens with the checkups too, where like not many people you meet are super open about like, oh, my, significant other and I just entered long-term therapy, or I started
Mhm.
seeing
mm,
therapy myself. This idea of this like checkup, tune up, like whatever you want to call it, it's, it's fun. Like the approach is strength based. So it's not, all right, so why are you
Yeah.
here? It's like, so how did you meet? And so it's almost like being interviewed on a podcast for an hour. It's fun. And so like people then go back and tell their friends, like, we did this checkup. It was like everything was great. And then we did it and everything's even better. And so there is sort of this like natural effect. And that's sort of what we started to see from our existing clients is they're like, hey, this relationship checkup's great. Like, how else can we use this checkup model? And that's, I think, where that sort of like systemic shift in the industry of why is mental health the only tertiary care health system? Like, that's what we're really hoping to sort of help usher in, is sort of this primary care checkup approach. And I think, like, being able to start with relationships which underpin everything makes all the sense in the world. You get two people in for the price of one. So like the benefit is doubled. So it's been great. And that, being able to overturn that more hesitant participant also helps with that shareability, where like if you get that person that was like, I was a little unsure and then I did it and it was great, they're going to go and convince more people like them that like therapy is not as scary, or the checkup isn't as scary as they might think. And there's definitely been a shift, I'd say, both in sort of like this the Zoomer generation and I think what Gen Z, but also like since the pandemic, like I think a lot more people are a lot more open to this idea of mental health. And when we get in front of them and get to tell them about like a proactive approach, that seems all better to them. So there's definitely, I think, starting to be a shift in mindset, where it's less, we're seeing less hesitancy and more just kind of openness and willingness to try it.
Yeah, that's great. And I assume this is not something that's funded by insurance, covered by
Actually,
insurance.
it is funded by insurance. So especially in states that are starting now to do you get to get an annual checkup or an annual mental health checkup.
Yeah.
It can be billed for that, and you can
Okay.
also it depends on the insurance, but there are, and the clients, but there are codes that you can use for either assessment or for seeing somebody with one of their family members.
Right.
Yeah, yeah. And for those folks where their insurance doesn't cover it, it's something that you do once a year,
Well, I was
right?
thinking about that, right? That investment piece is not the same as paying that same amount every week or something like that, if it's regular therapy.
Exactly.
Yeah, yeah.
Yeah, exactly.
And
Mm.
even just
Yeah.
looking at some of the like asynchronous like mental health apps out there that have sort of the freemium model, like just paying for a checkup out of pocket is still like about the same price as an annual subscription to one of these like premium apps. And so like, do you want an asynchronous app, or do you want someone who's trained and has been doing this for a while to do a checkup that has like clinical evidence-based background? And so it, if it comes down to price point, like I'd still rather have an actual human helping me
Me
than
too.
like using, some piece of technology.
Yeah.
I think that's,
Yeah.
it's such a valuable point, right? Because one of the things that we're convinced by is what's going on inside of our intimate relationships is quite complicated by its nature, right? And we aren't always in the best position to have any perspective on that, right? So when you're trying to do it on your own with like an app or with a book, right, that's helpful, but it's not going to help you see what you can't see. In the same way that like you might look at a mole on your arm and think, nah, that's probably fine, but you probably want to get an expert to look at it to actually tell you whether it's fine or not, right? And that's what the checkup model that we use provides, is that we have trained experts that this is what they do and they know what they're looking for, right? And I think one of the things that I'm most excited about podcasts like yours is just this opportunity to have to get this change in
Yeah.
how we think about it. So I just want to like come talk to you and to your listeners to just like say the words relationship healthcare over and over again, right? To start to get people to think in those terms, right? Like, how do I think about my relationship as something that deserves regular care?
Well, yeah, and you know what strikes me when you say that is just knowing what I know about the mental health field. When a couple comes to therapy, we have to choose the identified patient, right? And then we have to give a mental health diagnosis to that one person. I mean, even that lens of
Yeah,
insurance billing is all about, well, it's really about what's wrong with someone,
right.
right? And not even like, yeah, we may be doing couples, but we're not even billing it insurance wise in a way that makes sense for this idea of relationship healthcare. It's all
Exactly.
been individual healthcare.
Right.
And so that's fascinating to me. It really is a paradigm shift. And I think one that we are all coming around to so much post COVID, that our relationships matter so much, and that
hmm
loneliness is a big thing and isolation has been a big thing for
hmm
people. So why not treat our relationships in the way that we would any other type of healthcare? So I love it.
Exactly. And one of the things that I've been the most delighted by, and I guess both delighted and surprised, is that the segment of our country that is actually taking this the most seriously is the military. And
Oh.
as in most things, people might be surprised to hear, but if you think about it, it makes sense. Like it's almost always the military that's innovating the next like wave of something, right?
Mhm.
And the military has been laser focused in a way that the civilian sector hasn't been in in recognizing that what is affecting the health of our service members is their relationship,
Mm.
and and we need to be able to address that health system at scale, right? And so they've actually been our biggest supporters and the
Mm.
most interested in what we're doing because it is brief, because it's attractive, and because it's evidence-based, right?
Mhm.
And because it's scalable, right? Because it's the vision that we have is everybody everywhere should be able to get a regular relationship health checkup annually, right? And
Mhm.
so we've built it in such a way that it can be scaled. And if the military wants to really have, they do, if they want to have a major effect on the quality of their service members' lives and their health, like this is the sort of thing that you need. Like to your point earlier, you just can't hire enough tertiary clinicians to meet the demand.
Yeah.
That isn't scalable.
Mhm. It isn't.
It's
Yeah.
sort of piggyback on that. Like we've sort of looked at our existing clients, and they've been able to pivot a certain proportion, usually around like 10 to 30% of their time, they're starting to do checkups in. And that kind of equates exactly to the number of cancellations they have, where if they, if
Mm.
one of their normal patients is going to be on vacation in a couple weeks, they can't see a long-term, they can't take someone off the wait list to become a long-term client, but they can do a checkup.
Mhm.
um, and so we've seen a lot of providers sort of doing that model. And when we've looked at that at scale, there's actually enough mental health providers in the country today that if they just spend 10% of their time doing checkups, everybody in the country can get some sort of mental health care. And if you have a tool that's brief and 12 times more effective than like a single long-term therapy session, it kind of makes sense to embrace this model. And that's where you can actually start impacting sort of the supply and demand. You can start impacting sort of the increasing price of private pay, which
Mhm.
we've seen astronomical hourly prices that some people are charging, because that's just where the supply and demand sort of
Mhm.
graph is going, is that
Yeah.
okay, supply's low, demand's high, prices go up. And so we're really hoping that that can sort of be the wave of the future, where we don't need some drastic, oh, we need to start sending more and more people to get
Mhm.
their masters or their doctorates, because we just need a huge supply influx of mental health professionals. We actually have the workforce today, we just don't have the model to do it. And so
Mhm.
that's, I think, sort of the innovative piece for us, is like, we're screaming it from the top of the mountaintops of like, if we just shift this system to a primary care approach, we're going to have less people entering long-term care, because we're going to start getting to people early and often, which is going to help reduce some of the supply issues where everyone's in long-term care. And we're going to start preventing issues from getting so extreme that you get to the okay, we're going to relationship therapy because this is our last ditch effort. Like, we don't want people getting to that point because they're doing early and often maintenance.
I'm curious for you, Matt, you were coming at this more from the entrepreneur side. What has it been like to sort of take that lens into this product and into the mental health industry?
Wow. There was a lot of learning that I had to do. I've kind of been in like sports and tech for a while. Coming into the mental health field, I think it's relatively clear that there's a lot of room for improvement. That, like, to James's point earlier, it's a little bit of an antiquated system. I think part of the issue is the health system in this country is incredibly complicated, and even the people we talk to at insurance companies aren't always so sure how insurance works. I'm sure everyone has their own horror stories of, like when we did DNA testing when my wife first got pregnant, and the office like sent our blood out of state, and because they did that, insurance wouldn't cover it. And I'm like, how am I supposed to know that as a patient to tell our like doctor's office not to send our blood out of state? Like, it's just a complicated system, and so it's slow to move, right? We had that barge like jammed in the Suez like a year or two ago. That's my viewpoint of mental health, like, and just the healthcare system. It's like jammed in the Suez, and it's really difficult to unwedge this barge. And it's going to take a lot of hands to do it. But I think, sort of with my entrepreneurial lens, I'm starting to see a big shift where there's more and more startups in the mental health field, which is a good thing. I think there's, not all of them are evidence-based. I think not all of them are attacking the problem the right way. I'm biased because I think we're attacking the problem the right way. But yeah, it's starting to get to a really good place. And I think, what's been great for sort of the work that we've been doing is sort of this brief and effective, is just the way people's brains are wired these days. Like, people want their information quick. They don't want it long term. They want it to be super effective and impactful. Like, I want to be able to Google something and have it be the top couple results. I want to be able to go to, like, ChatGPT and get something good really quickly. Like, that's sort of where our head's at. And what's beautiful about this checkup model is it delivers that. And James in his lab did an adaptation for perinatal care. And we were talking to sort of embedded providers in like the OB departments, and they're talking about how often people mention their relationships as an issue at that 20-week, 6-week postpartum, 9-month postpartum, where you see sort of these influxes in PPD, maternal suicide, maternal substance abuse, all terrible things that we wish we could fix. But the problem is they ask for help and the system's overwhelmed, and they can't see that couple or that patient because they have a wait list. And so by the time they come off the wait list, the baby's already there and their world's upside down and they're scrambling and they don't know which way's up. And that's where instead of just doing long-term care, if we build a primary care checkup model, we can start addressing these issues in real time, effectively and quickly, so that these people can help themselves. And James alluded to this earlier, but it can't be undersold, this idea of like, I can look at a mole, I can Google what do skin cancer moles look like and try to make my own best guess, but chances are I'm going to terrify myself. Chances are I'm not going to get the answer right. I'd rather have a professional look at it. Like that's sort of where mental health is today, where like people are trying to do it on their own. They're following TikTokers or like Instagram people, but they don't have access to care. And that's, I think, what's beautiful about this is like opening up that pipeline of, there's a way that we can make the supply better so that more people can access it, so that more people don't have to rely on Google for their relationship issues or their mental health issues. That just can't be acceptable in the country anymore.
I love it. Your passion is really inspiring. I can just feel that both of you are really trying to make a change in access to mental health. So we've got to wrap up, but I just want to leave you with this one question, maybe for each of you to answer. What is just one thing that you would like people to know, whether it's people accessing care or entrepreneurs who are thinking about starting something new? What would be your one thing to leave people with?
I think, for me, that one thing is that the key to health is prevention.
Mm.
That if you want to have good physical health, like take good care of your body. If you want to have a really strong relationship, like do preventative relationship care, right? Like if you want your car to last for a long time, right? Like
Yeah,
do
get your oil
maintenance,
changed.
right?
Yeah.
Exactly.
Mhm.
And you can't do it on your own. It's too complicated to do it on your own. You really need, and of course, we as a community need to cooperate by providing the professional services that people need in order to, if you're
Yeah.
gonna have long-term health, prevention is the key. I think for me, for entrepreneurs, is that it's okay to dream big, right? Like it's
Mm.
actually possible I think it's possible to make big changes. You just have to be willing to dream it.
Yeah, I love that.
I mean, James, that sounds like you've been hanging out too much with me. I think my the degree I had, international development and social change, we were tackling big issues like world hunger,
Mm.
right? Like that was stuff we debate in the classroom. And I think what really helped me from an entrepreneurial standpoint is you've got this huge problem, like, but how do I address hunger today? Like I'm just one person, how am I supposed to do that? Um, and so I think like that's where, yeah, like we want to change the system here to a preventative approach. And we're starting that today with this approach to relationship checkups. Like
Mhm.
this is going to be sort of hopefully the drop in the bucket that makes it overflow. For my like sort of leave behind, I'll take a more like entrepreneurial take on it. Although James went surprisingly entrepreneurial there.
I know. Did that
So
shock you?
no, for 8 years now, I've been like, sort of imprinting entrepreneurship into James's brain, and he's been imprinting sort of the relationship healthcare and this like, mental health field on my brain. So it's been awesome.
Yeah.
Um, so I guess I to me, some of the best business ideas are the ones where whoever you're talking to says like, oh, that makes so much sense. Why didn't I think of that? Right? Like the
Mm.
greatest ideas are so simple that it's like I could have come up with that. And when I'm out talking to people, networking, which like every entrepreneur listening, like there's nothing better than just like pressing the flesh and meeting people. I sort of tell people like mental health care is this tertiary model. The only thing that exists is crisis care. Like we should probably be doing things proactively. Like imagine what the world would be like
Mm.
if we had a preventative, proactive approach to mental health care where it became normal for our kids to go to their pediatrician and then walk down the hall and talk to a therapist for half an hour, not because anything's wrong, not because they're in crisis, just because that's how you can detect things earlier and head them off before your only option is a lifetime of taking pills. Um, and when I say that to people, they're like, "Oh, you're right. There is no primary care model for mental health. It makes so much sense that we should do that. It would probably save insurance companies a lot of time. It would probably keep down like the ER visits, which is like
Mhm.
all you heard during the pandemic was stop going to the ER for things, right? Like they're
Right.
overwhelmed, right? But we only have the ER for mental health, and
Mhm.
they're overwhelmed, but there's no primary care model. And so like it's one of those ideas that to me it makes so much sense. Everyone I talk to thinks it makes sense. It's just a matter of making the industry, understand that it's possible today to sort of solve some of these issues.
I love that. Well, thank you both for your time and your inspiration. It's been awesome to have you.
Thanks so much,
Awesome. Thank
Rachel.
you.